Hello, my name is Fran D'Amato, and I'm a student nurse, and I will be teaching you about the drugs haloperidol and haldol decanate today. Now, to begin, they're very similar drugs. The main difference here is going to be that the haldol decanate is for more long-term effect, lasting about 4 weeks, and that is something that you would give intramuscular route versus the haloperidol, Haldol, that will be oral. That'll be the by mouth, and you will take that once a day or even twice or 3 times a day, depending on the psychiatric disorder. So to begin, this is to cover both of them. They're both antipsychotics, and they are indicated for psychiatric disorders. For the patients who are chronically psychotic, they'll need the prolonged therapy, so that's where the decanate will come in, and that'll be every 4 weeks. The dosage is normally 5 to 100 milligrams intramuscular every 4 weeks versus the Haldol or haloperidol. The dosage will be much smaller. The initial range could begin from 0.5 to 5 milligrams, and that could be twice a day or 3 times a day. You could also give that drug intramuscular, and that would be a higher dose, 2 to 5 milligrams every 4 to 8 hours. Now that also always just depends on the weight and the situation. So further, the contraindications for this drug would be if you had a hypersensitivity to the drug, or those who are in a coma, Parkinsonism, or CNS depression. You'd want to use caution in the debilitated patients and patients who take anticonvulsants or anticoagulants. Also, anti-Parkinsonism drugs or lithium would be a contraindication. In patients with a history of seizures or abnormal EEGs, severe cardiovascular disorders, allergies, glaucoma, or urinary retention. Another contraindication for both drugs would be pregnancy. The safety hasn't been established, so it's best to just not give this drug if a patient is possibly pregnant or even breastfeeding. Another contraindication would be the elderly patient. You'd want to use caution and start with a lower initial dose, and then you could gradually work your way up to the dose adjustment. So adverse reactions to these drugs. Your main adverse reaction that you'd want to look out for is the neuroleptic malignant syndrome, also known as NMS. That could be a fatal reaction, so you want to look out for any type of fever or muscle rigidity, and you want to report that immediately and don't give the drug anymore. You would also see extra pyramidal reactions such as tardive dyskinesia or any type of sedation, seizures. You could see a prolonged QT interval, and you might have some bradycardia. So you always want to check the vital signs prior to giving this medication. Leukopenia and leukocytosis are also a possible adverse reaction. And blurred vision, jaundice, rash, those are possible as well. So for the drug interactions, a couple things you want to consider would be nutmeg. That's an herb that could react badly with this medication. You might have symptom control, loss of symptom control, or you might have an interference. Also, with any type of psychotic medication, you do not want to use alcohol. It could increase the CNS depression. So always, always, always teach your patient not to have any alcohol. As a nurse, you want to consider that these lab results may increase the liver enzyme levels, and they may increase or decrease the white blood cell count. So like I said earlier, an adverse reaction with the leukopenia or leukocytosis. So you'd want to draw labs routinely. Moving on, the action of both drugs are to block the postsynaptic dopamine receptors in the brain. So for a therapeutic effect, it would decrease psychotic behaviors, which is what we're trying to achieve with these patients. Mostly, your schizophrenia or anyone who's experiencing any type of psychosis. So like I said, the available forms are going to be tablets for the haloperidol, but the haloperidol decanate, you're going to have an injection. And that is something that you want to make sure you never administer IV. Intravenous is a huge warning. Don't give it IV. Okay, so for the nursing process, the assessment, you always want to assess the patient's borderline disorder before the therapy, and of course regularly thereafter. And you want to document and make sure that there's no adverse reactions or drug interactions. Always monitor the patient for tardive dyskinesia, and it may even occur after prolonged use. So you want to make sure months and even years, you want to make sure that this drug is not causing those effects, because you could always add on different drugs to control those side effects. The huge alert here with the nursing process in the assessment is you want to ensure that they're watching for signs and symptoms of the neuroleptic malignant syndrome. So those are going to be the extrapyramidal effects, hyperthermia, automatic disturbance, and like the fever and rigidity that I spoke about earlier. It's rare, but it is very possibly fatal. So you want to definitely keep an eye out for that. So for the planning and implement, like I said, you never want to give IV. And when you're changing from the tablets to the decanate injection, you want to give 10 to 20 times the oral dose once monthly. So this will be a maximum initial decanate dose of 100 milligrams. Another intervention that you want to include would be teaching the patient not to stop this drug abruptly, because you could cause the severe adverse reactions. For the decanate, you'd want to use a 21 gauge needle and do not exceed 3 milliliters. You can give it in the gluteal muscle by the deep injection, and the Z-track method is recommended. So once again, another warning would be the elderly patients with dementia-related psychosis who are treated with this atypical or conventional antipsychotics, they're at an increased risk for death. So this antipsychotic is not approved for treatment of dementia or related psychosis. Lastly, I want to talk about the patient teaching. So when I'm giving this drug, you want to inform the patient to avoid any activities that require alertness or any psychomotor coordination until the CNS effects are known. Always avoid alcohol, and inform the patient to take the drug exactly as prescribed. Never double up to compensate for missed doses. And lastly, just a side effect that might cause discomfort, tell the patient to relieve the dry mouth with sugarless gum or hard candy. And you want to emphasize sugarless so that they don't have increase in any type of blood sugar levels or anything, or even like dental caries or any type of additional effects that we could avoid. So thank you for paying attention to my drug card teaching.